Good afternoon. I'm the President and CEO of the Surrey Board of Trade. My name is Anita Haberman, and I'm an honorary captain of the Royal Canadian Navy. Thank you for joining us on a very important topic for the future of our economy, and that is the BC vaccine card system. I'd like to acknowledge that we are on the treaty territory of the Tsawwassen First Nations and the unceded territory of our Coast Salish peoples, specifically the Kwantlen, Katzie, and Semiahmoo First Nations. Also, we live, learn, work, and play on the land of the Inuit and Métis. Ladies and gentlemen, events like this simply do not happen without sponsorship support. Thank you to our business and international trade center sponsors, the law firm of Fasken, BDC, the Business Development Bank of Canada, Scotiabank, and the Chambers of Commerce Group Insurance Plan represented by S&F Benefits. Thank you also to MLA Stephanie Cadieux, representing Surrey, South Surrey, for joining us this afternoon as well. Just a couple of opening remarks before we begin. All attendees are muted. If you do have a question, please put it in the chat function of the technology and who you would like to respond to that question. We ask you to keep your questions very respectful. This is a very hot topic. People have different perspectives about the BC vaccine card, but we ask you to participate actively when we get to the question period. Put your questions in the chat function. Ladies and gentlemen, the Surrey Board of Trade, we are one of the top 10 largest chambers of commerce, boards of trades in the country. There's 450 of us, and our mandate is to support business and bring business into the city. And Surrey is going to be the largest city in British Columbia by 2030. We have a diversified industry base in our city, and we are still growing by 1,200 to 1,400 people a month. And ladies and gentlemen, Surrey is an opportunity city, and that is why the Surrey Board of Trade was such an active advocate and supporter of the BC vaccine card. We wrote letters to the Prime Minister, to the federal health minister, to the provincial health minister, to the premier, asking for a short-term implementation of a proof of vaccination system because we could not afford another economic shutdown. That simply was not acceptable anymore. And we wanted to increase vaccination rates. And so I wanted to just provide to you a little overview of the BC vaccine card system. Our representative from the BC government had a last minute meeting, urgent meeting that she needed to take. So I'll be presenting on her behalf. As you may know, BC became the third province within our great nation of Canada to require proof of vaccination for people attending certain social and recreational events where transmission could be high. It's a temporary measure. It will be revisited in BC in January 2022. And certainly we had advocated for a national proof of immunization strategy where there would be a lack of confusion, but we have a federal election taking place right now, and hopefully things will be mitigated after that election is over on Monday. But let's present that slide deck. And again, if you have any questions, please put them in the chat function of the technology. So just one moment here. So the BC vaccine card system was implemented on Monday, September the 13th. And all of this information is public. The BC vaccine card is allowing people to conveniently and securely show their proof of vaccination using a digital or paper version. And I've been to several restaurants and live music venues, even in this 1 week. And I see that businesses through the Business Verifier app, which I'm going to be showing to you shortly, are making it easy for their consumers, for their clients. And for the most part, there are limited gaps with the BC vaccine card. We as a business organization in Surrey have received limited complaints about it since its implementation on Monday. So the BC vaccine card will show that you are either fully vaccinated, partially vaccinated, or no record found. The BC vaccine card has a QR code, which is a scannable square-shaped image like a barcode technology that is readable by a digital device like a smartphone. Very secure. There is a transition period of up to September 26th for vaccinated people to obtain their BC vaccine card. This is the grace time that is provided. During this time, the paper record provided at vaccine clinics that were provided to you will be an acceptable form of proof. That's your BC immunization record card. So if the QR code isn't working, that vaccine card, paper card that you received at the time of your vaccination will also be accepted by a restaurant, a nightclub, a live music venue by September 24th. So the whole process started and was announced on September 7th. And the actual website is noted on screen. 3 steps: enter your personal health number, date of birth, and date of vaccination. Step 2, get your BC vaccine card. Save it to your mobile device or print it. I actually have it set on my smartphone as my home image. And so all I have to do is show my image, and it is on my phone. And, it's just so easy for a restaurant. And just have your BC vaccine card ready. Some businesses may ask for your driver's license or another form of identification. It just depends on the business. But certainly for those affected businesses, your BC vaccine card is also available through the Health Gateway portal for Health Gateway users. So 3 results for BC vaccine card users. Your name is on your smartphone to indicate that you're vaccinated, or partially vaccinated, or no record found. How to get a paper copy of the BC vaccine. So the website can be used to print your BC vaccine card by the same 3 steps. If you need help, you can ask a friend or a family member. If you need help in a different language, there are different language options on the BC government website. Certainly through the Surrey Board of Trade's Rapid Response Pandemic Business Center, if you have any questions on this, we're here to help you, also in different languages. You can call the provincial vaccine line if you're a business or a resident. And the phone number is on screen. You can visit one of the 64 Service BC centers who can print your card for you. So there's so many options to make it easy for you. And definitely there are gaps, and the BC government is there to address those gaps. This is brand new for all of us. But as I said from the top of this meeting, we want to make sure that the economy doesn't shut down. We want to increase vaccination rates in as much as possible. And we ask everyone to be patient and kind as we get through the implementation of the BC vaccine card. So how to use your BC vaccine card when you arrive at a business that requires proof of vaccination. Have your digital or paper BC vaccine card ready. Also have your ID ready just in case. Number two, you're going to be asked to display your BC vaccine card along with a piece of valid government photo ID, as I just mentioned. People that are aged from 12 to 18 do not need to show their identification. Families and caregivers can carry a copy of their loved one's BC vaccine card with them or save multiple vaccine cards to their mobile device. The BC Vaccine Card Verifier app. So this is for businesses, those affected businesses, nightclubs, restaurants, bars, in-person, indoor, outdoor events. Businesses have two options to verify the BC vaccine card. Option one, scan the QR code. Option two is visual verification. Both work, both are okay. Businesses can download the BC Vaccine Card Verifier app from the Apple or Google Play Store. Businesses can verify vaccination status using the app alongside a second piece of government ID for those that are aged 19 plus. The app only reads COVID-19 vaccination information, and no additional health information will be stored in the app or smartphone. It is cyber proof in as much as it possibly can be. And I've received so many questions about cybersecurity on this measure, and it is safe. Your health records are not part of this BC Verifier app. So the business QR code scanning and verification is also very simple. I've seen it in action this week. Step one, from the BC government website, download the app from the App Store and allow access to camera. Step two, scan the paper or digital copy of the BC vaccine card QR code from your client. And then step three is check the proof of vaccine and validate the name with a photo ID of 19 plus. Visual verification. Businesses can also visually verify the digital or paper BC vaccine card, like checking proof of age for alcohol sales. It's meant to be very user-friendly, this whole proof of immunization strategy. On a person's BC vaccine card, make sure their name and vaccine details are visible. Verify BC vaccine cards with a piece of government issue photo ID for people that are aged 19 plus. So again, we are transitioning. We fully transition on September 13th, the BC vaccine card. It will be fully implemented on September 27th. There is support for businesses, step-by-step instructions on that government website. Again, the Surrey Board of Trade's Pandemic Rapid Response Business Center is here to help you, as is the BC government line, the information line to help you. And we encourage businesses to reach out to their industry associations, if you're a restaurant, your restaurant association, etc. If you have any questions whatsoever. And of course, there is the helpline. Privacy and security of the BC vaccine card is really designed using the global smart health card framework. Smart health cards use QR codes to keep a copy of your record on hand. The framework is a standard for provinces in Canada to create a consistent approach. These standards, they only store the absolute minimum information required to verify a vaccination. Do not post your QR code on social media. So you want to submit and update your information for the BC vaccine card. In the event your date of vaccination for dose 1 or dose 2 is not correct, go to the immunization record website as noted on screen to submit your updates. Students that are new and returning BC residents vaccinated outside of BC must use this service to submit their vaccine records. Submitting your information takes less than 5 minutes, and every effort will be made to add your vaccine record within 4 to 7 days. However, this service will be impacted during periods of high volume. Acceptable out-of-province proof of vaccination. So people from other Canadian provinces or territories, they must show their provincial or territorial officially recognized vaccine record, a valid government photo ID. A list of acceptable out-of-province vaccine records will be shared with businesses and available on that Government of BC website. That's why we wanted a Canada-wide proof of vaccination system, so we didn't have to go through all of this, but here we are. And international visitors, they must show proof of vaccination they use to enter Canada. So only fully vaccinated visitors can enter Canada, and they have to show their passport as well. So in a nutshell, I could go on, that is the BC vaccine card system. And I look forward to addressing any questions that you may have on that. And so now let's go to our first panel speaker, and it's my honor to welcome the President and CEO of the Canadian Chamber of Commerce, the Honourable Perrin Beatty, for his remarks. Perrin, over to you.
Anita, thank you very much. Thanks first of all, for having me. And then secondly, thank you for the leadership that you and the Surrey Board of Trade have shown throughout the pandemic, and that you're showing on a very difficult issue here, one which is contentious, but one which is extremely important for all residents of British Columbia. You've just gone through the BC system, and others will want to add to that. I won't comment specifically on BC because others have much more expertise than I have. But what I want to do is take just a few minutes to talk about some of the issues involved in vaccine certification, some of the reasons for it, and some of the approaches that we at the Canadian Chamber would like to see taken nationally. Let me start by saying that it's been quite a ride for all of us for the last year and a half. None of us anticipated in March of 2020 that we would still, in September, a year and a half later, find ourselves dealing with yet another wave of COVID, and that it would be as fierce as the one that we're dealing with. Our goal, the goal of every government, the goal of every business, every Canadian, needs to be, first of all, to ensure the safety of Canadians during this fourth wave and during any subsequent wave that we may be faced with. And secondly, to hasten the day when we can safely get back to normal. From a business perspective, we need to be able to move away from an economy that's subsidies-based to one where, once again, both families and businesses are able to be self-sustaining again. Most importantly, as we're dealing with this fourth wave, which has shown a virulence and force that none of us could have anticipated when it started, it's going to be very important for us to, first of all, keep people safe, keep them alive, ensure that they don't contract the disease wherever possible. But then secondly, to ensure to the greatest extent possible that we avoid the need for another general lockdown. Canada has had some of the longest lockdowns anywhere in the world. The social and economic consequences of that have been enormous. I don't have to tell you about the impacts in terms of the spread of illicit drugs, family violence, mental health issues, and of course the impact on literally tens of thousands of businesses that have been put out of business, and so many others that have been forced to acquire large debt and are struggling today to try to make ends meet. What we need to do is to ensure that we don't go back into lockdown. Some of the areas of Canada, Toronto would be an example of that, have had the longest lockdowns in North America and some of the longest in the very world. And the impact of going back into lockdown again would be simply devastating for so many businesses, for families, and for others. So what's important when we're looking at bringing in a system of digital certification, and we use that terminology instead of vaccine passports, which is a bit of a misnomer. It's important to see these as a means of helping to protect public safety and keeping people alive, but also of avoiding having to go into more devastating lockdowns that could be so harmful. The option isn't that either we simply remain open and it's life as before or business as usual, or that we simply lock down. There has to be a system that can avoid the problems that come from not having public health measures in place. And we've seen in Alberta, for example, the recognition that their healthcare system is under enormous strain and runs the risk of being overwhelmed. We don't want that to happen in Canada, nor do we want to go back into those lockdowns that I was talking about earlier. So we have to have a system of risk management that allows us to focus on the areas of highest risk while allowing the greatest amount of freedom, both to businesses and to individuals as well. And that's what vaccine certification is designed to do. It allows us, for those people who have been fully vaccinated and who represent the lowest risk, there's still a risk involved, but the risk is substantially lower once people have been vaccinated. And if they're taking other measures to protect themselves, it allows us to resume our lives and to resume our ordinary business activities on a much more normal basis than would otherwise be the case. And it allows us to focus on those areas of highest risk. And this, to a very great extent, is becoming a pandemic of the unvaccinated. We're seeing that, notwithstanding the fact that 3/4 of Canadians are fully vaccinated, we are still seeing a fourth wave with a ferocity that none of us could have anticipated. And we could see a fifth or sixth wave as well until we're able to get this pandemic fully under control. What we've seen this week is a number of provinces coming on board and announcing their intention to put a system in place. The most recent ones are Alberta and Saskatchewan. New Brunswick is looking at having a system as well. Next week, Ontario's system is up and running. And so these are coming in across the board. Anita, you were mentioning that what you would like to see is a national system, as we would too. The challenge here is the delivery of healthcare services is in the jurisdiction of the provinces. And as a result, then the federal government can't impose one system right across the board. What we need to do, on the other hand, is have federal leadership to ensure there is at a minimum interoperability. So when we look at the standards that we need to see in any sort of a digital certification system, we need to ensure that it's interoperable. It has to be interoperable internationally so that people who are traveling are able to use their credentials, and so that we're able to recognize credentials of people coming to Canada. And it needs to be interoperable within Canada so that someone from Surrey who goes to Montreal is able to simply show their pass from British Columbia and be accepted in the same way as they would be at home. And we need to have standards in terms of how this is applied that are as consistent as possible for businesses that operate across provincial boundaries. To deal with a hodgepodge of competing regulations makes it exceptionally difficult for those companies to be able to function. So we need harmonization, and that can be done. There are other instances where provinces have their own systems, but where we have interoperability. We have it with our healthcare system, with our health cards. We have it with our driver's licenses as well. So it can be made to work, but we need to have as much harmonization as possible. The system has to be secure. That's why it's digital. What we can't afford is to have fraud. We need to ensure that people are who they say they are and that they are vaccinated if that's what they're claiming to be. And we need to have a system which is efficient as well. If you have a number of international jumbo jets landing at the same time at Vancouver International, and you have to process thousands of people, or if the Vancouver Canucks are having a game you're having thousands of people come into the arena, or if there's a concert, you have to have a system which is digital, which enables you very rapidly to determine whether somebody is able to function or not. So those are some of the key elements. The other element that I want to mention is from a business perspective, and that's that it is critical for governments to assume their responsibility for this. They must not be leaving businesses out there hanging out like a piñata for people to take a whack at. We've seen a number of instances where people have attempted to use intimidation and pressure tactics on businesses to get them to not ask for credentials, or for them have them drop other measures that are in place to protect public health. Governments themselves have to make it clear that it was their decision, based on good public health criteria, to implement a system, and that everybody is required to follow the law, and that the store clerk or the waiter in a restaurant is not the bad guy here trying to prevent you from being able to get a service, but rather somebody who's simply complying with the law. Without that, it puts business in a very difficult position. Two other comments before I wrap up. One is, I think it's important for us to understand the enormous pressures that so many small businesses have been under in Canada today. They have seen their expenses going up. They have seen the difficulty they have even being able to survive. And their goal is obviously to be open and to be able to serve their customers to the best of their abilities. And when they see a new system coming in that may restrict the number of customers they have, many of them are literally at wit's end. And you can understand their frustration, their anger, and their wish that all of this was over. And all of us wish that was the case. We need to be there to ensure that they have the supports that they need, that we shop local, that we provide every assistance that we can. But we also have to understand that the single most important thing that we can do is to ensure that their employees and their customers remain safe and that they're able to remain open. Then finally, what we're seeing taking place is a pressure campaign. We've seen it directed against hospitals, frontline workers, patients, and others, and we're seeing it ramping up against businesses as well. For example, I heard today about a campaign in one community where people are threatening to go into businesses next Wednesday in Ontario when the new system comes in, simply refuse to present any identification at all and break the law and use force if it's necessary, if they deem it necessary to do that. That's simply unacceptable in a society like ours. And the authorities have to make sure that they provide the assistance to business across the country to be able to function and to comply with the law. So that is an overview, perhaps from a national perspective of where we are. All of us want to get back to normal just as rapidly as possible. And we need to do everything we can to ensure that. We need to do everything we can to ensure that people's lives and their health are protected in the interim. By working together, we can achieve that. And we can get back to more normal lives more quickly. So thank you very much. Let me stop there, and I'm looking forward to hearing from others.
Thank you so much, Perrin, for your remarks and for your partnership. And ladies and gentlemen, again, just a reminder to put your questions in the chat function and who that question is directed to. And I know Mr. Beatty has to leave a little bit early, so any questions for him will proceed to first after all the panelists have spoken. Our next speaker is from the South Asian COVID Task Force, and we've been working very closely with them at the Surrey Board of Trade. He is the Medical Director of PrimeCare Medical Center in Burnaby and at the Edmonds Urgent and Primary Care Center. Ladies and gentlemen, please help me welcome Dr. Baldev Sanghera. Baldev?
Thanks, Anita. Welcome to everybody. And I just wanted to let everybody know that I'll be providing you with some medical background as to what is COVID and what we can do. So let's head into this. So initially, and some of this information has changed over the last 18 months. So I'll be clarifying some of that as well. Initially, when we first were introduced to COVID at the end of 2019, we were under the assumption that it's just a simple respiratory virus that causes upper airway type symptoms by infection. So you ended up getting nasal congestion, sore throat, mild fever. You may lose your sense of smell and taste, and you may have diarrhea, etc. But since then, we've also found out that this virus causes more than that. It can cause organ inflammation. It can cause impact on your lungs. You can cause heart disease. It can impact your muscles. It can impact your brain, causing the folks to be left with something called brain fog. And at the same time, it can also impact your nervous system. So you have decreased sensations in your hands and feet. It also impacts mental health directly, not just by the impacts of the pandemic, but also direct impact on your brain. It can change the way that your brain is wired to deal with emotional aspects. So more folks are being left with anxiety and depression, etc. And approximately, I'd say the majority of people tend to recover fairly well with some management, but there's about 30% of folks are left with what we call long COVID, or the other term that you may have heard is long haulers. And these are folks that have got that muscle inflammation causing fatigue, brain fog, decreased physical capabilities. So as an example, I have a young male who used to run three times a week, 10 kilometers each time. And he's a very avid runner. After his COVID infection, he unfortunately now has difficulty getting up the stairs. And we're working with him to help his lungs heal. That long COVID it causes a lot of disability, and that's impacting employers. It's impacting the individual, obviously, but it's also impacting their families. People are left less functional, and that's one aspect that we don't talk about. We have seen an approximate 2% mortality within the people that are infected. So 1.7% to be exact of mortality. But as we've seen in jurisdictions where the infection spread rapidly, we start to see more variants of the original virus developing. So around the world, like initially when Italy and England got hit, there was the Alpha variant, and then South Africa, and then Brazil, then India, and now Peru and Chile. So we're starting to see different variants coming. The current predominant variant that we have in BC and in Canada, I would say about 99% of the infections caused in BC are caused by what is known as the Delta variant. And this Delta variant, the difference between it and the original virus is that it's about 10 times more transmissible, more infectious, and so therefore can impact more people. Initially, we used to be told that if you were in close contact with somebody for about 15 minutes, you're at a high risk of being infected by the original virus. This current virus only requires anywhere up to about 3-minute introduction to somebody being close. And so it's highly transmissible. We've also learned that it is airborne, right? So that's a different connotation to the initial descriptions that we were given, that it was droplet contamination. There are more variants coming. We've now been told that there's a new variant called MU, and the difference between that one and the Delta variant and the other ones that have been before it is there's some evidence that this variant has learned to be able to evade antibodies. So we may not have protection against this. So far, we've only got a few dozen cases here in Canada. But we'll have to keep monitoring it. It is a risk that we are trying to mitigate. Right now, because of the transmissibility of Delta variant, that seems to be overpowering the Mu variant itself, right? So we'll see where that goes. The impact of COVID on Canada has been that we've unfortunately seen 27,000 people dying from this disease. And in BC, it's about 1,877 deaths that we've had. We've had to individual people have had to suffer symptoms, and some, about 30%, with prolonged disability, and that's still ongoing and maybe lifelong. Because this infection is so new, we're still learning what it's doing to us and how it's impacting us. As Mr. Beatty had mentioned, we've have to suffer through the lockdowns. The individuals have had impacts onto them, the social isolation leading to mental health issues, drug use, the deaths associated with the drug use, more alcoholism, and then also a dampening of our economy. The biggest impact from the impact on our economy has been borne by small business and any business that has been dealing with people where you've had direct contact with them. Online businesses have thrived, and we've seen Amazon making huge profits. So, I mean, there's at least that side of the economy has been doing quite well. The tech sector has done fairly well as well, since we've all switched over to Zoom meetings and to other IT media interactions. So now that we know that COVID is airborne, we have to change our approach and how we deal with this. So it's no longer sufficient to say, keep washing your hands and wipe down all your groceries before you bring it into your house. That may not be that impactful, right? So what we need to continue to think about is, how do we prevent airborne transmission? And airborne transmission is going to require changes in how we deal with masking and also ventilation. And it's also changed the way that we initially thought that we would be able to get out of this pandemic. Initially, the thought was that, as we've seen with other diseases, 70% of the population being vaccinated would provide herd immunity. But because of the new variants coming like Delta, which are very much more highly transmissible than the original virus, we are now seeing that the studies show that we are probably going to need to hit at least 90% vaccination in order to achieve that herd immunity across the community. Right now, across the community, we're seeing on average around 71 to 72%, and that's including the children. If we don't include children under 12, we're sitting somewhere around 84% full vaccination. So we're not quite there for herd immunity, and so therefore we now need to do other things to mitigate the impact of COVID. What this pandemic has shown us is that I, as an individual, can probably protect myself, isolate myself from everyone, and be safe from COVID, but that'll have other impacts on my life. So therefore, we can't fight this pandemic alone. We have to fight this as a community, and we need community approaches to do it. As the business folks here, and as I have a large clinic, so I'm an employer as well, I have a duty to protect my workers, my staff, and also my customers that I see in person. So we need to take approaches to do that. And what things can we do? Easiest thing that we can do, and this is a mandate by the government, in any public interaction indoors, we all should be wearing masks. And we should be wearing them properly. So a properly worn mask covers your mouth and your nose, not just your mouth or just your chin. It has to be worn properly to close off any holes behind the mask. We need to improve ventilation in where people work. If you do nothing else but you open your windows and you open your doors and you allow air to cross flow through your workplace, you will provide a lot more protection. We've seen this when restaurants were switching over to patio dining. When they had open patios, much safer, very little transmission. In closed patios, which were essentially recreated an indoor room, the transmission was occurring again. The other thing that we can continue to do is, if needed, where people have to be close together, try to maintain some distance. Being on top of each other isn't very helpful when we're dealing with an airborne virus. And then lastly, the thing that we really need to focus on is making sure that we can get to that 90% vaccination rate. We have Currently, right now, we have two very, very excellent vaccines available, one from Pfizer, one from Moderna. We did have one from AstraZeneca before, but we no longer have any supply of that one. These are very safe vaccines. There are some impacts on where injection sites, you may get some soreness, you have some symptoms of feelings, muscle aches, fever, etc. after the injection, which usually disappear within 24 to 48 hours and then back to normal. The side effects that prevent you from getting vaccinated are very, very rare. We've had issues with muscle inflammation or heart inflammation or blood clots that were seen with the AstraZeneca vaccine. And again, those are rare, 1 in 100,000, 1 in 60,000, that kind of range, and not very common. The other reason to not get vaccinated is if you have a demonstrated severe allergy to the vaccine itself. And so we closely monitor folks when they go to get vaccination, and we keep a track of that. So if anyone's had a rare extreme reaction, we will tell you that you should not get a second vaccination, and therefore we'll leave it there. We will then be able to provide you with an exemption. Once the vaccination is done, then we have to have a system in place, as Anita had demonstrated to us. The vaccine certification process is a must. If we're going to be bringing people into our businesses, into our homes, and into any location where we're going to be fairly close to each other, we need to prove to each other that we are relatively safe. Once you've been vaccinated, you have a 90% protection. Not 100%, unfortunately, but you have a 90% reduction in your risk of catching the virus from somebody else. So with that reassurance, we can be together closer while wearing masks indoors. If you're in a restaurant, obviously you have to take your mask off to eat. But I would, other than when you're eating, I would recommend that you wear your masks. When folks have been vaccinated, if we compare them with the folks that are unvaccinated, as Mr. Beatty had mentioned, this is a pandemic of the unvaccinated now, right? And so looking at hospitalizations and the folks in ICU, more than 90% of the folks there are unvaccinated. And the actual outcomes of being hospitalized are much worse. So you have an unvaccinated person has a 37 times greater chance of being in hospital than somebody who's been vaccinated. And once you're in hospital, you have a 10 times higher chance of dying. Extreme, yes. And we need to help people make the right decisions to protect themselves. We're getting there, but there's still a lot of misinformation out there. Unfortunately, internet allows it to spread, and we collectively need to help each other understand what the actual real risks are and move forward. So I'm happy to answer any questions that folks have. And I'm available. Thank you.
Thank you so much, Baldev. And again, if anyone has any questions, please put it in the chat function of the technology. And our final speaker is the Senior Associate of the law firm of Fasken to give us the legal perspective. Please help me welcome Jordan Thompson. Jordan, over to you.
Thanks very much, Anita. I'll just ask everyone to bear with me for a sec while I share my screen. I think that should look all right for everyone. So yes, again, thanks, Anita, for having me. Thanks to the Board of Trade. Thank you to Mr. Perrin and Dr. Sanghera for your interesting and useful comments on the vaccine card. So as Anita mentioned, I am a senior associate in Fasken law firm, operating mainly out of Surrey in the labor, employment, and human rights group. And so my plan is to briefly overview the provincial health orders as they relate to proof of vaccination, discuss who is affected by the orders, discuss the impact on workplaces, and cover some of the key legal issues relating to the orders. And I understand I have about 10 or 12 minutes, and I suspect I'll be a little bit shorter than that. So for anyone interested in reading the orders specifically, there's the links to the two of them there. And I will cover this briefly because Anita did a very succinct and good job at describing what the orders cover. But essentially they apply to a variety of businesses across BC in limited application to the patrons and guests of those businesses. As most of you are familiar, so one of the orders applies to restaurants, cafes, pubs, bars, nightclubs, etc. And the other one is more generally aimed at social gatherings, such as indoor concerts, theater, dance, symphony, other events like that, and gyms. There does appear to be a willingness from the government to carve out kind of specific exemptions relating to gatherings that have an overriding social or health-based benefit to them, such as health and social service providers, fitness facilities, rehabilitation, exercise programs, worship services, healthcare related events, alcohol support settings. These are indoor gatherings that are exempt from the requirements for proof of vaccination. Individuals and businesses can both face administrative penalties and fines for refusing to comply with the orders. They're capped out at about $575 for individuals and $2,300 for businesses. And there's, as you've probably seen in the media, quite a number of questions about how businesses can go about enforcing the orders in terms of requiring proof of vaccination or refusing service to those who are refusing to offer that proof. Premier Horgan's mentioned in statements about how the police could be called to use to enforce some of these orders. Obviously, that has a lot of various other concerns that the police have expressed, as well as the businesses themselves. So, enforcement will be difficult where there is those kind of trouble cases, and I would recommend assessing that case by case as necessary. And so, as of right now, in my view, kind of the best course of action for businesses is going to simply be to maintain compliance with the orders, require proof of vaccination for all patrons and guests if you fall under either one of the orders. Without question, the kind of the most contentious issue relating to the orders is the seeming lack of permissible exemptions for individuals who are unable or unwilling to be vaccinated. The order, well, it's not exactly clear. It does appear to carve out an exemption for somebody who has a medical contraindication, which Dr. Sanghera just described. Essentially, in my lay understanding, the person needs to basically be allergic from receiving any type of either vaccination. And other than that, the province is taking a very hard line and not appearing to not grant any exemptions for the vaccine proof relating to physical disability or sincerely held religious beliefs. And I think, a lot in my field, a lot of us expected further exemptions that would be in place. And, given that BC does seem to be taking a stricter approach than provinces like Ontario, where they have carved out specific exemptions for that, it could be the case that these orders are challenged on a constitutional basis, which I'll certainly talk a little bit about, very little bit about more later. That said, the province has given a strong justification for the lack of exemptions. Number one being that this is a temporary measure set to end at the end of January 2022. And the second being that, the measure, it's a reasonable measure given the public health importance of preventing the spread of COVID. So as a employment lawyer, naturally, I've received a lot of questions about the applications of the orders to employees in workplaces generally, where these orders do apply. For example, common question is, can I have staff working who aren't vaccinated and or I'm unaware of their vaccination status, who are requiring our customers or our patrons to prove vaccination? And the orders define, which you see on the board here or on the screen, which individuals are subject to demonstrating proof of vaccine, and the government has specifically opted to define patron and participant, as you see on your screen there. These definitions mean that the vaccine requirement does not generally apply to employees or service providers at the venues or businesses that are subject to the order. Further, the order relating to social gatherings generally specifically makes an exemption for, quote, workers at a workplace when engaged in their work activities, including staff meetings, end quote. And, I think this is kind of a cognizant decision of the government to not, attempt to legislate into the workplace and take that further step of requiring vaccines in the workplace as they did specifically for long-term care settings. That would just open up the order to further, legal challenges. I've also had some questions about whether these rules, and I think this might touch on one of the questions that was put in the chat earlier, but the questions relating to whether the orders apply to people coming into a workplace or a business to perform a service, but aren't patrons or participants as defined above. So for example, this is a very basic example, but if you operate a restaurant and you need a plumber or electrician to come in, or is there an obligation to assess vaccination status prior to admitting them? And in my read of the orders, they do not require that. It's simply requiring proof of vaccination for people who are using the service as a recreational or discretionary benefit, but not people generally performing services there, and certainly not your employees. And I would also add a caution that employers don't use this order as kind of a justification or basis for imposing a vaccine requirement on your employees either. Obviously there's logical reasons why the same rules would apply, but simply due to the fact that the employer wouldn't be able to, if challenged in the human rights context or a constructive dismissal context or a privacy issue, wouldn't be able to point to the public health order and say, this is kind of our basis for requiring vaccines. So, it would be very risky, and I wouldn't advise you do so on the basis of the current order. And so, as I mentioned, there's very limited exemptions for the proof of vaccine requirements at the businesses that are covered by the order. And numerous groups in the media and otherwise are advocating that the orders are infringing or really flying in the face of human rights protections provided in the BC Human Rights Code, which, as you see on the board here, the code prohibits the denial of service customarily available to the public on the basis of one of the protected grounds there that are described on the board. The key ones being, disability and religion in this context. So the orders and corresponding announcements from the government state that basically that the rules are absolute and that there is no accommodation mentioned for individuals who cannot receive the vaccine for a legitimate reason, such as sincerely held religious beliefs or a physical disability, aside from the being allergic to both types of the vaccine, as I mentioned before. So there's really not, from a pure kind of human rights law perspective, there's no doubt that the orders are, prima facie discriminatory to those individuals. But the question is whether there is a reasonable justification for that discrimination. And, as you see on the board there underlined, that's kind of the test applied by the tribunal, whether there's a bona fide and reasonable justification for the discrimination. And that's essentially what the government's done here. They've built in that justification by producing this order and making these businesses follow suit. In the event a business does receive a human rights complaint, it will be able to simply point to its obligation under one of the two respective orders and the promotion of public health generally as a justification for the discriminatory conduct. And as I said, this position is getting a lot of scrutiny in the media and from some legal advocates as unduly restricting human rights of people who are not able to get a vaccine for a legitimate purpose. But the subgroup of the population who is legitimately unable to receive a vaccine due to a medical condition is so small that granting these individuals an exemption from the vaccine is not going to have a discernible impact on the government's public health goals. And that's kind of the basis of those complaints. But how the tribunal responds to the issue, I'm not sure what they'll do, and it'll be interesting to see as that unfolds over the next little while. And of course, you've probably, if you've been following the media, also heard the orders are likely subject to challenges under the Charter of Rights and Freedoms, which prevent the government from taking action that infringes on individual rights. Now, I'm not a constitutional lawyer or a conflict of laws expert, so I'm not going to comment on that in great detail. But in my view, if someone's alleging that they're being discriminated against in the human rights context against one of these businesses that are subject to the order, that individual's first recourse should be to challenge the underlying law itself through a charter breach application. Otherwise, we're stuck in the position where businesses, some of which could be very small, mom and pop businesses, would be required to go to the time and expense and costs of litigation to justify essentially the government's order that's requiring them to show or to gather proof of vaccination. So just kind of best practice for employers from the human rights perspective at this stage, follow the orders in I think what the extremely rare event that you're faced with a human rights complaint on the basis of denying service. One, there's a very strong, reasonable justification for the alleged discrimination. And two, more importantly, any such complaint should be held in abeyance or put on hold until the court has assessed the constitutionality of these orders. It shouldn't fall on individual businesses to be defending the order if they are challenged on that basis. And then just briefly, I'll touch on, some privacy concerns. And Anita already did a good job describing what is contained in the QR code and how that information is being held, et cetera. So, as a general rule, collection, use, disclosure of anyone's personal information in BC needs to be done reasonably and needs to be done for a legitimate purpose. Again, the government's kind of already done this for the businesses by producing these orders. So businesses could simply point to the order and say, look, it's our requirement to gather and use this information. What businesses want to be careful about doing is not collecting more information than necessary. So the QR code contains very basic information: name, date of birth, date of vaccine, type of vaccine, and I think location that the vaccine was received. Obviously, if you're operating with the QR code, just use that and don't gather further information. If for whatever reason you're collecting information in a different format, try to collect the same information that you would get if you were collecting information through the QR code mechanism. And with following those rules, I don't suspect businesses to have any issues from a privacy perspective. The BC Privacy Commission's been generally supportive of, I'll say privacy intrusions where there's a legitimate basis rooted in, public health and the prevention of the spread of COVID-19. As long as the scientific evidence continues to support that, vaccination status is a effective mechanism at reducing transmission, then I don't suspect the Privacy Commission's stance to change on that. And there should be very limited, if no, privacy-related risk for businesses collecting this type of information. And that's it from me. I'm sure there'll be some questions relating to some of what I've discussed and some for the others. So happy to take those. And my contact information is on the screen there if anyone has other more detailed questions they'd like to follow up with. Thank you.
Thank you so much, Jordan. And ladies and gentlemen, if you have any questions, put them in the chat function. If all of the panelists can turn on your cameras so we can see you. And my first question is directed to Perrin Beatty. Perrin, tell me about what you would like to see the next leader of this country focus on as a priority after Monday's election as it relates to the COVID-19 pandemic.
Anita, there are two focuses that we have. The first is the short term. How do we navigate the pandemic in protecting people's safety and protecting their lives and ensuring that we don't have to go into another round of lockdowns? So what sort of measures do we have to have in place in the short term? Having a harmonized system of credentials for vaccine certification would be one example of that, but also maintaining support programs that exist for small businesses today. Even as we start to come back into reopening, as the fourth wave subsides, we start to reopen businesses. Some sectors and sizes of businesses are going to require continuing support. The tourism, travel sector would be an example of that. And so many small businesses have acquired $200,000, $250,000 worth of debt, and they're straining. And it would be tragic if we brought people this far and allowed them to drown 50 feet from shore. We have to help them make to the other side. The other thing that we'll be looking for is a long-term strategy to restore growth. We need to move away from a system of lockdowns and subsidies to where people and businesses are again autonomous and able to stand on their own feet, and where they're paying taxes and contributing as opposed to costing. We're going to be faced with a $1.4 trillion debt by the time of the next election. And it means then that to deal with that, we have to have investment, we have to have growth at a level that's considerably higher than it was prior to COVID, and that growth is going to have to be sustained. And so far, we haven't seen a strategy from any of the parties that would enable us to achieve that.
And Perrin, just one more question for you, because I know you have to go, is what is the role of the World Health Organization to work with different countries all over the world around an international vaccine passport system, really to create certainty for the travel sector? We all travel for work-related reasons and also for, just to relax, right? So what is the role of the World Health Organization from your estimation?
Anita, the WHO focuses on health issues as such. For example, they would be tracking progress around the world in terms of vaccination or in terms of the spread of the virus. They would be coordinating measures when it comes to what should be the standards of accepting vaccinations. For example, if somebody's coming to Canada, should we accept the Sputnik V vaccine as being acceptable in Canada, or a Chinese vaccine? But it's IATA and other organizations that are looking at setting the standards for international travel credentials. And what they're focused on is what's the nature of those credentials, what sort of information do you have to have, how can we ensure that they're interoperable? And the Canadian government is engaged at that level in terms of trying to develop a Canadian system that is interoperable internationally. It's not easy to do because different jurisdictions have their own standards in terms of what they're looking for. For example, in the certification system they have in New York State, not only do they record, as BC is doing, whether or not you're fully vaccinated, but there's also a capacity in there for looking if you've had a recent test to validate whether or not you have the disease or not. It may be in some instances the jurisdictions will require those in addition, as Canada does with people coming in addition to proof that you're fully vaccinated. And it may be in some instances that people want to build those into the apps. Our government has to look at how do we ensure that our system is as interoperable as possible, both domestically and internationally as well. Anita, let me just close, perhaps, if I may, with one other comment, and that's that governments across Canada reluctantly are creating these systems. Nobody they weren't anxious to put them in place, but they recognize that what they're doing is bringing in a system that is infinitely preferable to the alternatives, that we can't allow COVID to continue to kill people. The doctor gave the statistics both for BC and for Canada. This is a deadly disease, and we cannot pretend anything else. And we're going to have to live with it for some time yet to come. And governments have an obligation. Their single most important obligation is to protect the lives and safety of their citizens. So they must act there. But the question is how? And for a year and a half, Canadians have been subjected to brutalizing lockdowns that have had such an enormous impact on mental health, drug abuse. Doctor, you went through the list. One of the items we could add as well is delayed surgeries, or people with advanced cancer coming in and having had a medical checkup. The cost of this disease and of the lockdowns and of not bringing this under control is enormous, and the cost to the business community is enormous. And what governments are trying to do is to find a system that allows us to live our normal lives to the best of our ability and to keep people safe. Finally, it is absolutely legitimate for businesses and for chambers of commerce and boards of trade and for others to debate, well, what businesses should be covered by this? What should the criteria be? That's absolutely legitimate. But the debate now has to shift from whether we're going to have these systems to how they're going to function. And that's where we should be focused today.
Perrin, thank you so much for your presentation and your remarks and your support to the Surrey Board of Trade. And you're welcome to leave the meeting, but I do have some questions for our other panelists as well.
Anita, thanks so much. And it was a pleasure to be with the other panelists. And thank you for your leadership.
Thank you. Have a good weekend.
Bye.
Dr. Sanghera, do you think at this stage of the pandemic, will it be safe for people with pre-existing medical conditions to return to the office, particularly interacting with people or meeting with clients? What's your advice on that?
So it's a nuanced answer to that. And so it depends on the individual, right? It's always going to be about the individual risks that we all have. So each individual has to look at what pre-existing medical conditions that they have. The higher risk folks will be the ones that have got weaker immune systems or are immunocompromised because of some other medications that they're taking. For example, there will be patients who are currently being treated for cancer, but they're functional and they want to participate in their work. And while they're undergoing chemotherapy, they need to be protected. So in their situation, I would recommend that they not come back to in-person meetings with people because they're at much higher risk. There may be other folks, for example, that are with certain forms of severe asthma or COPD, inflammatory arthritis, or colitis, those kind of conditions where they're using stronger immunotherapy medications. Again, weakens their immune system, but controls their disease. So they are absolutely functional, they can work and they can and be very productive, but they can't risk being exposed to a virulent virus like COVID-19 is. So in their situation, they too, it would be based on their own risk that they have to, and also the risk of the going back to that particular workplace. For example, if they, say my office, it's mandatory now for all healthcare workers, not just long-term care, as Mr. Thompson mentioned, but across the board. It's acute care as well, and community clinics as well. It's mandatory for us to have all of our staff vaccinated, and so that we don't put our patients at risk, and we don't put each other at risk. So we're already burning out our staff, we're overwhelmed, and we don't want to lose people from the workforce. So we need to make sure that our staff are protected. In my office, 100% of the staff are vaccinated. If one of my staff was one of those folks with an immunocompromised situation, I can have them work in the office amongst my other staff, but they would still have to wear a mask. And they still have to maintain some distance between themselves and other folks when they're eating. But we can provide that in a setting where they're not coming into direct close contact with unmasked individuals. So those kind of things have to be worked out. And it's all individual employers, individual folks will have to assess their own risk. And I would recommend that the individual person discusses their own health risk with their family physician and come to some sort of meaningful understanding of where they're at. So I know it's not a simple answer. It's very nuanced, but it does require that level of discussion and also assessment of the workplace. Smaller businesses may not have that, luxury of having a large space for folks to work in. And also production line workers may not have the luxury of, again, being in a nice ventilated environment. So each environment is going to be a little bit different.
Jordan, what's the legal perspective on that?
Yeah, it's very much aligned with Dr. Sanghera's explanation. It's case by case. As he mentioned, employers have an ongoing duty to take all reasonable precautions to make sure that the workplace is safe for all employees and everyone attending the workplace. And if that means that somebody who's immunocompromised cannot return or needs to return with certain accommodations, as he explained, it's going to depend on what other safeguards are properly put in place in that workplace. Can they social distance? Face masks are, a thing that's going to work. Otherwise, it's looking at alternatives like, remote work arrangements. It can be very flexible, differing start times, different break times, things like that. So distancing can be followed. The other legal aspect of that question, is where employers are wanting the individual to come back and they don't feel comfortable, kind of the flip side of it. So again, that the employer would need to conduct kind of a workplace safety type of analysis and see what measures, if any, are necessary to have that individual return to work and go from there, kind of as an ongoing dialogue with the individual employee.
Another question from one of our attendees, and I don't know, Dr. Sanghera, if you can respond to this. They're having an outdoor pumpkin patch event, draws 400 to 500 people, not ticketed, seems impossible to check vaccine passports, not clear on what the rules are related to outdoor events and vaccine passports. Do you have any intelligence on that?
I'm going to make two comments. One is about one of the comments that Mr. Thompson made earlier, and that is that you've got folks, one of the barriers to coming back to work is also anxiety, right? So that there may be mental health issues that have come up since this pandemic, and that you can't mitigate that with just wearing a mask or providing somebody with a distance place to work. And so they may need other supports as well and other treatments like psychotherapy, counseling, etc., in order to be able to come back. So that's I just wanted to mention that side of a return to work piece. But with regards to outdoor events typically have been well ventilated, and so as long as people are somewhat distant in an outdoor event, it can be done very, very safely. I would strongly urge people to recommend that they continue to wear masks if they're going to be coming closer to other folks. And even though an event is not ticketed, and I'm not completely aware of the mandate of the government to recommend that we continue to check vaccine, but it's quite easy to download the vaccine verification app and just scan people as they come in. It doesn't take that long. Going to a restaurant on Tuesday took less than 15, 20 seconds. So it is easy to pass people through. It may actually give you a better count of how many people come through, and so that you can support your business that way. And you're showing people that it's safe for them to come to your location, because there's a variety of opinions out there. Some people won't go to a place that is checking, and other folks won't come to a place that's not checking.
We have a company that provides industrial safety training, and the training often takes place at the customer work site. And so what they're asking is, do participants in the training require vaccination to participate in the course? And are masks required? Baldev, any intelligence on that?
So again, this would be more of a legal question, I think, for Mr. Thompson, but it's an interpretation of the rules that's going to be required. So if it's an organized event, and you're bringing people together in a closed environment, and it can be considered to be public, then people should be required to prove that they have vaccination, and continue to wear masks whenever you're inside.
Jordan, the legal perspective.
Yeah, my reading of the orders as they are now is that there wouldn't be a requirement in that situation of, well, certainly not of the service provider, and then if they're going into a business to provide that service, I don't think, I don't think it applies to either of them. I do agree with Dr. Sanghera that of course the mask rule would apply, but this is not an event open to the public. It is a service being provided to a business privately. And from what based on what it says in the orders, I don't believe that, a vaccine check would be required based on the orders as they are right now in that situation.
Jordan, another question for you from our audience. An employer has to make work accommodations for an employee who may be immune compromised to ensure a healthy workplace. However, if the employer doesn't feel safe because they don't know if their fellow employees are vaccinated, is that okay according to WorkSafe BC? How is that a safe environment? What's your perspective on that?
So, the question is, how can an employer provide a safe workspace without knowledge of vaccination status? I don't think vaccination status information is necessary to do that. Employers have been providing safe workspaces since the onset of the pandemic by following the protocols, sanitary distancing, face coverings that WorkSafe BC has put out and revised and developed over the last 18 months. Obviously, the collection of vaccine status, it raises human rights and privacy concerns, but it does also allow an employer to, kind of put the final touches on having safe workplace protocols and procedures in place. So, I mean, I think ideally the information could be collected and used to ensure a safe workspace, but at this time, it's not necessary for your average business to do so to meet, occupational health and safety requirements.
Dr. Sanghera,
Anita, just a quick addition to what Mr. Thompson mentioned, and that is that in order to create a safe work space, one of the protocols that we can put into place is people self-assessing themselves before they come to work, whether or not they have any infectious symptoms, right? So if you have infectious symptoms, then you need to discuss that with your supervisor. How are you feeling? I have a sore throat, I have a fever, I have congestion, I'm coughing. That's a necessary thing. One person being off work is better than a whole office being off work.
Mm-hmm.
Very true. Dr. Sanghera, do you think, as it relates to airborne transmissible diseases, do you think this year we're going to be faced with a twindemic? We have the COVID-19 pandemic and then flu season. What do you think?
Well, based on last year, we actually had a very calm flu season because last fall, when the flu was circulating, we were all wearing masks and everybody was isolating. So we didn't actually get that many cases. And at the same time, we also had a 30% higher uptake of the flu vaccine. So I'm expecting the same thing this year. I think the majority of people will be quite actively seeking flu vaccines, and we're continuing to wear our masks quite widely, and that's providing a lot of safety. So I don't believe there's going to be a twindemic. We're just going to be, the only issue that I have is then we have about 700,000 people that are unvaccinated in BC, and they're continuing to transmit the virus amongst themselves and making other people being at risk of being exposed to other variants that develop. And the risk we have is as one variant dies down, another variant can come in and create another wave. So wave 5, 6, 7, that can continue if we're not careful.
Dr. Sanghera, will this ever be over? Everyone asks me, will this ever be over? What are your thoughts about it?
So when we say, will this ever be over? There's a bunch of different things to think about. Are we hoping to go back to pre-2019 behavior patterns? I don't think that's going to be possible. We're seeing, if you look around the world, there's only 2.3 billion people that have been vaccinated around the world. So that leaves us with another 4.5 to 5 billion people that are unvaccinated at risk of continuing to get infected and develop new variants. We are going to be dealing with some form of needing to protect ourselves for some years to come until either this type of virus burns itself out, or our immune systems get stronger, we develop other vaccines that are even better at preventing infection. And we may need to start to look at how we build out our homes, our businesses, improving ventilation, improving the way that we interact with each other. So yes, I 100% believe we are going to come out of this, but it may be a new normal. And it may be a better society. We won't be going back to pre-2019 behavior patterns.
And Jordan, my last question is to you. When it comes to the Employment Standards Act, do you think COVID-19, vaccine passports, all of the things that we've had to deal with is going to revolutionize employment standards and how different governments deal with legislation related to HR?
We've seen some changes related, and when we continue to see lobbying, I think that's really, was driven by some of the realities of COVID-19 regarding, specifically paid time off for, receiving vaccines, which is great, but that's very specific to what we're talking about. But with that, we saw a lot of push for things like paid sick time generally, things that have never had, a place in employment standards before. where really what the government was doing is setting minimum kind of entitlements for employees that employers couldn't go below. But yeah, we've seen a bit of a move to more, gratuitous benefits like paid time off for various reasons. We continue to see more job protective types of leave added to the different acts over the last several years. Will it overhaul anything? I don't think so. I mean, the logical next thing could be some type of, work, hybrid work arrangements, remote work, hours of work type of situation. But it's hard to contemplate what that might look like in terms of legislation. So, I think we'll continue to see more employee benefits added to employment standards over the next several years. But, will it change anything drastically? I don't believe so.
Well, thank you so much, Baldev and Jordan, for offering your perspective and your expertise on this very important topic related to the BC vaccine card implementation. And ladies and gentlemen, thank you for joining us. We have 2 upcoming digital learning labs on 2 very important topics coming up. September 22nd is focused on cost-effective recruitment. September 28th is networking in the new normal. Check everything out that we offer to Surrey's business community at businessinsurrey.com. And remember, Surrey is an opportunity city.